Good morning. This is Daniel Savino and Amy Westling at the Association of Regional Center Agencies. Thank you all for joining this collaborative effort to discuss the public charge proposals. I'd like to immediately pass it off to Judy Mark.
Thank you. Welcome, everyone. We really appreciate you getting on this call at bright and early in the morning on a Friday morning. My name is Judy Mark, and I'm the president of Disability Voices United. We're an organization that's directed by and for individuals with developmental disabilities and family members, calling for choice and control, equity, accountability, and outcomes that matter to us. We are so pleased to be co-sponsoring this call with the Association of Regional Center Agencies, or ARCA, and Disability Rights California, or DRC. We will have 3 other speakers besides myself today, but I wanted to let everyone know on the call today that we will be recording this call so that those of us who couldn't join in will be able to listen to the recording, and we will get the link for you to listen to the recording. We will get that out to all the participants on the call afterwards. So Daniel, if you wouldn't mind, can you tell me how many folks have joined in to see if we need to wait a little bit longer?
At the moment, we have 44 folks on the line.
Okay, well, I think 44 folks is, we will reward those 44 folks who have gotten on the call on time, and we will move forward. So this issue of public charge, I know some of you may have been hearing about it, is of great importance to our community, the developmental disabilities community. We are in California, the state with the largest population of immigrants and the largest developmental disability system. And so we have to pay special attention to what is happening in Washington, D.C. that could profoundly affect the people in our state. We also want to ensure that individuals who receive regional center services understand the importance of what the public charge rule, the proposed rule is, and that they don't take any actions that are unnecessary, that they continue to receive their needed services. So the other thing I wanted to mention is that this call is about the broader issues surrounding the public charge rule, and not specifically about any case. So as we take questions, which we will after the 3 presentations, I encourage you not to present a particular individual case, whether it's an individual immigration case or a particular regional center client, or any other kind of individual, because we're not going to be able to provide advice for an individual. However, you could ask broader questions of individuals who have certain circumstances. So moving forward, I want to thank you all again for joining us. And now I would like to introduce, for our first speaker, is Amy Westling. Amy is the Executive Director of the Association of Regional Center Agencies. Go ahead, Amy.
Thank you so much, Judy. As Judy mentioned, we're here at ARCA also thrilled to have the opportunity to join you all this morning and talk about this important issue. And one of the things that will be covered today is how to get involved and engaged on this issue. One of the ways to do that, of course, is to submit comments to the federal government about your thoughts and feelings about this particular proposal that would change the definition of public charge, which would impact some people's immigration if they use certain services that many people in the disability community utilize. ARCA has submitted comments in opposition to this change already, and one of the biggest points that we raise is that the people that will be impacted negatively by this change are not only those who are directly impacted by the new rules, which are pretty complicated, but also people who don't understand the rules well, and as we've seen in other immigration issues, When people don't understand rules well and think that accessing services is going to negatively impact them, we see that people who are actually eligible for services and for whom there would be no impact to their immigration status also drop off of using services. Even just in the last couple of years, we've seen in certain communities a reluctance to access services because of concerns about immigration status. And one of the things that we know is that when people access less services, they are not getting the types of supports that they need. And this is particularly true for young children, that children need services as early as possible in order to achieve the greatest developmental outcomes. And we know that immigration is complex and confusing, and it's also an issue that's really central to a lot of families. And so what we've seen over the years in the 1996 welfare reform, but also recently in changes to federal immigration policy, is that people err on the side of caution and don't access services, even those that wouldn't negatively impact them. And this is really one of our biggest concerns. Thanks so much, Judy. I'll hand it back to you.
Thanks, Amy. I'd now like to introduce Alyssa Gershon. Alyssa is the Litigation Counsel at Disability Rights California.
Good morning. Thanks, Judy, and thanks to everyone who's participating in this call today. DRC, as many of you know, operates statewide. We have several regional offices where we work on a variety of disability-related legal issues, and we also operate the Office of Clients' Rights Advocacy, where our clients' rights advocates provide information and legal advocacy services to regional center consumers throughout the state. We have gotten many, many questions about this public charge proposed rule. It was in discussion for a long time before the proposed rule was officially released. And we're really glad to have everybody on the call today to get some real information. And what we really want to do is encourage people to make their voices heard. So to that end, we have on our website, which is www.disabilityrightsca.org, we have a short page related to this issue with some fact sheets about Medicaid, which is one of the programs that will be considered, and Sarah will talk about this more. But we want people to have correct information. We want people to understand what the real rule might do, how it will impact them, submit comments, but also, as Amy said, not be motivated by fear and decline services that people in California need and their family members need in order to remain safe and healthy and in the community. So we're really glad that you're all here, and a number of DRC and OCRA staff are on this call. So if folks call us for legal advice, as they do every day, we will be able to share accurate information. And also please know that for individual circumstances, we would really refer you to an immigration expert, because we want to make sure that people are getting the best advice possible. So thank you.
Thanks, Alyssa. And now we're really, really thankful and thrilled to introduce Sarah Dar. Sarah is a health policy manager at the California Immigrant Policy Center. And she's truly an immigration expert. She's not a disability expert, so we're going to sort of move back and forth as questions come in. But Sarah has been very involved in fighting against this proposed rule, and we're really, really thankful that she could join us. Go ahead, Sarah.
Good morning, everyone. This is Sarah with the California Immigrant Policy Center, or CIPC. Thank you so much for having me on. There's a lot to get through, so I will dive right in. without saying too much about myself or my organization. So public charge, what is it? It's a term that is used by a particular federal agency, which is USCIS, United States Citizenship and Immigration Services. In the 90s and before, that agency was formerly known as the INS, so some of you might know it that way, but then we had some shifts after 9/11 and our government renamed some things. So the agency is USCIS. They are the agency that processes people's applications for any type of immigration paperwork. So that term is used by that particular agency. And it means, it's defined currently, and this is still true today, as someone who is likely to become primarily dependent on the government for their day-to-day subsistence. And that's defined as, for more than half of the cost of their day-to-day living. And the word primarily is very important there. It means it's not just that you're getting some help from our government. It's that, the government is the core source of your day-to-day cost of living. So that's how they define it. And it can be, if USCIS deems somebody likely in the future to be a public charge, they can use that as grounds to deny them one of two things. Either one, admission to the United States. So if you are at a consulate abroad and you are applying to enter the United States via a number of different pathways, that is when you might be subjected to this test of public charge where the immigration official assesses the likelihood, yes or no, are you likely to become a public charge, and am I going to deny you admission to the United States based on those grounds? Or the second place where it can apply is when someone is applying for a green card, also known as lawful permanent residency. Those are the only two situations in which the public charge test might be applied to somebody, and that is actually written into federal law. It's written into statute, so that can't change. So the federal government right now, what they're doing is attempting to make regulatory changes, and there's some aspects of public charge that can be changed through regulations, but there's certain aspects of public charge that are written into law and would require an act of Congress to change, and one of those aspects is who public charge applies to. They cannot change that. So I want everyone to really keep that in mind. So the public charge test is not applied when someone is applying for citizenship. There's no public charge test. Doesn't come into play when someone is renewing their green card or lawful permanent. Plenty of categories of immigrants who are exempted from the public charge test even when they are applying to enter the country or for a green card. And that list is quite long, and I won't be able to list it all comprehensively. Know that anything I mentioned today on the call, there are resources, fact sheets, there's an abundance of materials that I will make sure to share with the organizers of this call so that you guys have that. But some examples of the exempt categories of immigrants are refugees and asylees. They don't face a public charge test when they enter the United States or when they apply for a green card. Survivors of trafficking, so T visa applicants, survivors of serious crimes, U visa applicants, people that self-petition under the Violence Against Women Act, so VAWA, special immigrant juveniles, SIJ, people applying for TPS, temporary protected status, and there are others. But I think refugees and asylees are the major category there that it's important to remember are exempt. So how does an immigration official, when they're deciding, do I think this person is likely to become a public charge or not, how do they make that assessment? Well, it's really completely case by case, and that makes it, difficult for a lot of us to kind of take a guess at, what will be my standing when I, go to apply for my green card. It's impossible to know for sure, but the immigration official is required to look at all relevant factors that, might be relevant to somebody, to demonstrating somebody's ability to support themselves. This is called a totality of circumstances. That's just the technical term for saying they should look at everything. Again, there are certain factors that are written into statute that the immigration agent is required to consider, and some of those include the person's age, their health, their financial resources, their family situation, so, who else is in their family that might be able to support them, and also how many dependents they might have that they are supporting, their skills and work experience, so things that, pertain to employability, and other factors. Those are some of the things that immigration officials are supposed to consider. One thing that's really a big factor in that is sponsor. So many of you know, like when you apply for a green card, if you have a family member here in the United States, they can sponsor you. They submit what's called an affidavit of support, and that letter is basically it's a binding contract where, the person is saying, and it's written up usually as just a letter, but it's technically a binding contract where the family member is saying, I will, support this person and make sure that, again, the majority of their day-to-day costs of living will be taken care of. Now, where do public benefits come in, like Medicaid and other things? Well, that is one factor that is a part of the public charge test. It is not the only thing. So again, keep that in mind. Just use of benefits alone is not the only thing that makes you or doesn't make you a public charge. But it's one thing that immigration officials are allowed to consider. Now, today, the way the rules are and how they've been for decades, in fact, centuries, is that the only two types of public benefits that can be considered are one, cash assistance for income maintenance. So that's things like SSI, TANF, which in California here we call CalWORKs, and then long-term care. So you are institutionalized and the government is paying for it. So for example, I'm in a nursing home and, it's paid for by Medicaid. So cash assistance and long-term care. Cash assistance for income maintenance and long-term care. Those are the only two types of benefits that can even be considered. Things like Medicaid, food stamps, or CalFresh, as we call it here in California. All the other, WIC, all the other services that you might think of that, the government chips in to help people out are not considered because, again, because somebody has Medicaid and is having certain healthcare services provided, through Medicaid, or because someone is, getting help with their food assistance, that's not the thing that's like paying your rent and that you're subsisting off of, right? It's assistance that people might need, from time to time in their lives. It doesn't make you someone that's primarily dependent on the government for your day-to-day cost of living. So none of those benefits are currently considered, and that is still true today. Nothing has changed as of today about the way public charge works, and that's really important to remember. And I'll get into this further when we talk about the changes that the administration is trying to implement, but it will be several months before we actually see changes implemented that people need to consider in their lives. So just really keep that in mind. So what is the government trying to do? They are trying to change the definition of public charge to not just someone who's primarily dependent on the government for their subsistence, but someone who uses or receives one or more public benefits. As you can see, that widens who might be counted as a public charge drastically. It's anyone that might have at any point used or received public benefits. But it does maintain the totality of circumstances test, so that's important to keep in mind. And then it adds new benefits, federal non-cash benefits that currently are not allowed to even be considered by the immigration official, and it says they can now consider these things. So what are those benefits? They are basically three main categories: medical benefits, housing, and food. And the specific programs are Medicaid, except for, and there are exceptions, the proposed regulation mentions emergency Medicaid as being exempted, so it wouldn't be counted. It also mentions certain school-based Medi-Cal for children, and that does relate to specifically children with disabilities. And it names those particular exemptions to Medicaid. And, emergency and pregnancy Medicaid is also, thought of as being part of emergency Medicaid. And then it mentions TANF, so Temporary Assistance for Needy Families, which is a federal food assistance program, again, here in California, known as CalWORKs. TANF is the cash assistance grant that's already counted, that's CalWORKs. And then SNAP, which is food stamps, as sometimes people call it, or CalFresh here in California is what we call our California food SNAP program. And then it also includes some benefits around housing assistance. So Section 8 housing vouchers, certain types of rental assistance are also included in the proposed regulation. And then also the Medicare Part D low-income subsidy. So that's very specific. So some people that have Medicare get assistance for their Part D prescription drugs. Depending on their income, they might qualify for a subsidy. So that subsidy, they want to also include that in their new future definition of public charge. Now, there's a lot of other public benefits that are not included in the rule, and so that includes, like we said, certain exemptions within Medicaid, like emergency and school-based Medicaid, certain school-based nutrition services. Public education, generally speaking, people attending public school, and that includes Head Start. WIC was excluded. The Affordable Care Act, if you're getting a plan through Obamacare, as some people call it, or here in California, it's called Covered California, our health insurance marketplace. If you get subsidies to help you pay for your insurance through Covered California, that was excluded. The earned income tax credit, and then they have a number of other exemptions. One big one to consider is anything that's fully funded by the state government or local or tribal government. Those are also excluded, except, as we said before, the stuff that already is counted in public charge, which is long-term care and cash assistance. Other than that, state and locally funded services are excluded. So we're talking federally funded services of the categories that I mentioned before. So this is what the administration is intending to do. This is what they have proposed, and they have to go through a particular process, which is called notice and comment period, which we're in the middle of right now. So they've written up this 400-page document that says, here's the new rules that we want to implement, but they can't do that without giving the public a 60-day period to submit their feedback on what they think about this rule. We are in the middle of that 60-day comment period right now. The last day to comment will be December 10th. So people have the opportunity to either go online. You can submit your comments by snail mail, but I've heard from a lot of advocates that do this type of advocacy to really recommend trying to find someone that can help you submit your comment online, just because it'll guarantee that your comment makes it there by the deadline. Whereas snail mail, there could be delays or things could get lost. So we're in that comment period right now, and people have an ability to say, I don't think it's a good idea, for example, to include Medicaid as something that people are penalized for using it, and it potentially threatens their ability to get permanent residency. And then once that comment period closes, the Department of Homeland Security, that's the agency that under which USCIS sits, that's the department that is proposing this regulation. They will then go through all of the comments, and they are required by law to consider every type of argument that's raised, and adequately respond to it or give some sort of justification. So as you can see, if they're required to respond to every unique type of argument or everything we can throw at them, they will. The more that we give them to respond to, the longer and more difficult it's going to be for them to finalize this rule. So they'll go through all the comments. They will have to, eventually they will publish a final rule, but in the preamble to that final rule, so they'll have the language of the final rule itself, but before that there's what's called a preamble, and in the preamble they have to adequately address every single thing we raise. So if someone says, this is, and arguments could be anything you can think of that might be an impact of this rule. So, for example, a local government, or for example, our attorney general and the mayor of the city where I live, Los Angeles Mayor Garcetti, and other elected officials, they've been submitting comments saying, hey, this is going to make it harder for me to do my job. This is actually going to cost the city of LA, for example, a lot of money. So there's arguments around fiscal impact that we are throwing at them, which they will have to address, right? They'll have to respond and say, well, no, here's why it won't affect you fiscally, or here's our justification for that. And then there's arguments we can make around in communities that are impacted, right? This is unfair to certain populations. This will cause adverse health outcomes, this will cause children in immigrant families to go without food, and this will cause issues with nutrition, and all kinds of arguments we can make about what kind of impact this will have. They will have to respond to all of that. So the more we flood them with robust arguments, the more they have to deal with before they can get to a final rule. Eventually, they get a final rule out, and they, publish it for everybody to see publicly. And then the implementation date when the rule takes effect is actually not until 60 days after it's published. So what that means is December 10th, this comment period closes. Who knows how long it will take them to sift through all the comments and come up with an adequate response to everything, and then decide what they're going to change, right? In their proposal, they're going to probably tweak it in some way to address all the things that are raised, come up with a final version, as well as that preamble, publish it, and that might take them several months. From what I've heard from others that have done advocacy in the regulatory process, it's often a many months process. Although with this administration, they're a little unpredictable and, are not, at times are not really, it's not really their intention to be thoughtful and deliberate and really incorporate feedback. They're just trying to ram things through. So maybe they'll try to rush it, but still there's no doubt it will take them, a substantial amount of time to go through all the comments and to do that. and then they'll publish that final rule, and then 60 days until it's implemented. And the proposed regulation, the language of it says that it would not be retroactive. Another really key thing to think about for families that, are considering, am I impacted by this? Any services you use now that are not currently considered in the public charge definition, so Medicaid is the big one, Medi-Cal, as we call it in California, cannot be used, counted against you or considered in your green card application until after the implementation date. So if you're enrolled in Medi-Cal all the way up until that day when the rule is implemented, and then let's say you disenroll at that time, your use of Medi-Cal in the past cannot be considered because, it wasn't part of the definition of public charge until that date. So that's really, really important to keep in mind. So at this time, what, National Immigration Law Center and others have been saying is we see no benefit to people to disenroll from any of these services that are not in the current definition of public charge. At this time, we see no benefit, so that's important to keep in mind. If and when something changes, you will know. You have wonderful advocates that are, creating information and materials for you to get a handle of it, and you'll be able to make those decisions for yourself at that time. Again, keeping in mind, it's only going to come into play if you're someone that's at a point of potentially applying for a green card. So the other thing about the rule is that it doesn't just add new benefits, but it fundamentally changes the way the public charge test works. It doesn't just say, okay, now we can consider Medicaid, now we can consider food stamps, now we can consider Section 8 housing. It also changes the other factors. So it adds a lot more language about, how an immigration official should consider certain factors. And it adds new, heavily weighted factors, both positive and negative. So they mention in the rule, here's some things that will be heavily weighted against you, right, in the public charge test. There's only one heavily weighted positive factor that's heavily weighted and positively helps you, and that's if your household income is above 250% of the federal poverty level. The only heavily weighted positive factor. Some heavily weighted negative factors, especially ones that might be, specific to this group or important for this group to be aware of, are health. So they mentioned that if you have a physical or mental health condition that could affect your ability to work or attend school, or that requires extensive treatment and expensive care, that's a heavily weighted negative factor. So really, really important to be aware of that. So even if you haven't received any of those benefits we talked about before, but you fall into this category of having a condition that, affects your ability to work or attend school or it requires a lot of care, that's going to be, counted heavily against you. Then they add some other factors as well, things that are just really egregiously unprecedented, like English proficiency. That's, by some definitions, that's literally just language discrimination, which is against the law. But they've included that. If you're not English proficient, it could be used against you. Your age, if you are under 18, in other words, if you're too young or too old to work. So if you're under 18 or if you're a senior and, you aren't able to work, that can be counted against you. Family size, they've mentioned, household size, if you have a lot of dependents, that can be counted against you. When there's a lot more in there, I mentioned it's like an almost more than 400-page document, so there's a lot in there. If you are uninsured and don't have any tangible prospect of receiving any kind of insurance, that can be used against you. If you are authorized to work, which, some immigrants are, but you're not working at this time and you're not a full-time student. So if you're neither of those, that can be counted against you. And there's a lot of negative things listed in there, but there's only one positive thing, which is if you're over 250% of the federal poverty level. For a family of four, that's a $62,000 household income. One thing that's really confusing about this is it doesn't say, there's no mathematical formula. Like if you have a health condition that's expensive to treat, that's -5 points. And if you use Medi-Cal for this long, that's -3 points. And if your income is this, or if you have a certain skill set, or something that makes you employable, that's plus this many points. There's no cut and dry formula. So they have mentioned all these factors, but we don't know how they're all going to come together to come to a final decision. That's really a case-by-case thing that's in the hands of the particular immigration agent or official that is processing your application. And that's one of the reasons why this rule is really, really concerning. It's really an open-ended and open to interpretation test. It's not something that families are going to have a clear sense of. Now, if people are wondering, oh my gosh, what might this mean for me? One thing to keep in mind is the rule is not final. They will take what they propose and consider all the feedback and make changes. And if stuff that people mention is, hey, this could be, if they're worried that some of the things that they've mentioned in the proposed rule could literally be a violation of, existing law, or could be, legally considered discrimination or things like that, they might be taking some of those things out, right? They might change this rule drastically. So I don't want people to start making decisions about their lives based on this proposal because we just don't know what's going to be in the final rule still. So it's really important to be aware of. It's just a proposal. And, it'll be easier to tell how it affects you once we see the final rule. So that's kind of more or less the overview. I guess I'll quickly address, I know people have raised regional centers. So they did mention Medicaid or Medi-Cal, as we call it here in California, in the rule, right? It's considered now. And they mentioned specific exemptions. They say emergency Medicaid is exempted and Medi-Cal services that are provided through IDEA, the Individuals with Disabilities Education Act. So this is Medi-Cal provided to children in school. And then it exempts certain other things. Now there's a lot of other stuff this is clear that the people at the Department of Homeland Security that wrote this rule don't really understand public benefits. And the reason why is because there's a lot of other stuff that Medicaid funds that isn't just, regular old Medicaid. Like I just go and I apply and I qualify for Medicaid and I get a Medicaid card and it pays for all of my health care. There's things like regional centers that are not addressed in the rule. So to be on the cautious side, what we would say is, well, according to the language of the rule, it's services that someone gets through a regional center that are paid for by the federal government. They're not explicitly exempted in the rule, and so therefore that's why advocates are saying, yes, it is possible that those could be considered. If this is the language of the final rule, which first of all we don't know, and this goes through and they don't make any explicit exemptions, potentially it could be considered in the public charge test. We don't know that for sure though. The administration, there's a lot that they just left out. There's a lot that they just left unclear. The same is true for, the state and federal funding. Like they said, service, programs that are state and federal and state and local only funded, they're not going to be counted. Well, there's a lot of people, for example, here in California that they have full scope Medicaid and they're partially funded by the federal and the state government both because of different categories of immigrants, for example, who the federal government doesn't pay for. And so we here in California say, okay, we'll cover these people. But those immigrants themselves do not know. No one knows, am I a state-only funded or federal funded? It doesn't say that on your Medi-Cal card, right? You don't know that. It's, maybe a few policy people in the Department of Healthcare Services that might know who those categories are. That's very difficult to parse out. So when someone's filling out their green card application and they have to check a box, have you received, public benefits of these certain kinds, they're going to think, well, yeah, I have Medicaid or I have had Medicaid in the past, and they'll check that box. And they won't know if they're state or federal funded. And so they won't be able to do that when they're attesting to this question. Same with the immigration official that's processing their application. They will not know. I don't think immigration officials know the detail about, how Medicaid is funded for different people. So it's going to be really how the question that a lot of people have been raising is, how the heck are you going to parse that out? And so, there's a lot that's really unclear. Let's just put it that way. And I know that sucks to say to people like, hey, look, there's a lot that's unclear, but there is. And the only, good thing is that helps us in a way because it gives us sort of ammunition to say to the Department of Homeland Security through this comment period, hey, there's a lot you guys haven't thought through. There's a lot about this rule that in practice and how you implement it, there isn't really a practical way. And so those are helpful challenges to the rule. I should also mention that there are national advocates that are, like the National Immigration Law Center, that are actively preparing for litigation. So just know that there's a lot already of grounds for suing the federal government over this proposed rule. And once the comment period is closed, that those advocates will begin that process. So a lot is unclear and, still unknown. But the important thing for families to know now is nothing has changed yet. Keep an eye out, turn to these wonderful advocates that have organized today's call and, check out the resources that they create, sign up for their alerts so that you know when things have changed and have the most updated information. And if you can, definitely go online and submit a comment. Tell the federal government what this would mean for your family and, what you think about this rule. And there's resources for how you can go online. There's if you go to protectingimmigrantfamilies.org, and again, we can make sure that this gets emailed out to everybody so you're not scrambling to write it down right now, but protectingimmigrantfamilies.org, this is a website that advocates, including the National Immigration Law Center, have set up where you can actually go online, and it makes it really easy for you to comment. You don't even have to go to the federal government's website, which is a little bit confusing and, I don't know, potentially intimidating for some people, right? You can just go to protectingimmigrantfamilies.org. It's user-friendly. There's a pre-populated comment there. So if you're kind of unsure what to say, there's a template. There's some text that's already filled out in the box. You can go in and edit it a little bit, and we would encourage people to do that so that they count your comment as unique and don't just lump it together as, oh, this is the same argument that 100 other people have already made because they just copied and pasted something. So go in there and add a couple sentences about what this might mean for your family and what your position is on this particular rule, and then you can submit your comment right there on protectingimmigrantfamilies.org, and you don't even have to go to the Federal Register website and do all of that whole process, and the website will submit the comment for you on the back end. So right now, the biggest thing to be aware of is that it's a time to take action and to weigh in before December 10th on this proposed rule. And then hopefully we will, we're working really hard to make sure that you have the most updated information after that comment period closes. So I've gone on really, really long, so I will stop and hand it over to the next speaker. I hope that gave people, enough information, but wasn't overwhelming. So thank you so much for having me on.
That was amazing, Sarah. I really, really appreciate that. This is Judy Mark again from Disability Voices United, and that was depressing and extraordinarily informative and helpful. And I know that there are lots of folks who may have questions. So we have a very special way that we're going to be doing questions, and I'm going to ask Daniel Savino from ARCA to help explain that.
Yes, folks, at this point, we do have quite a few people on the line, so instead of just unmuting everybody, for those of you who are interested in asking questions, I'd like for people with their first names, initials A through E, so I'm Daniel, so I would be in that group, but Judy with a J wouldn't. If your first name starts with the letters A through E, at this point, please press *6 on your phone to unmute yourself. Ask your question, we'll respond, and as soon as you ask it, please hit *6 again so as to avoid any background noise. Once again, *6 to unmute yourself. First names A through E. If you have any questions, please unmute and ask them.
And I'm going to ask for you to actually introduce yourself as well so we hear you. So anyone want to chime in first? All right. Hearing nobody, let's go to the next set of letters.
Oh, we've got someone coming in.
We do? Oh, great.
Crystal. This is Crystal from Disability Rights California. I'm just wondering if CAPI would be considered a cash benefit.
Yes, it would, although CAPI is state funded, so that's another one of those areas where we're like, would this count or would it not? And technically, according to the language of the rule, it wouldn't. Oh, sorry. Cash benefits are included no matter who funds them. Sorry. Yes, so that's already considered.
Okay.
Yes,
Thank
sorry.
you.
Any other questions, A through E? Okay, Daniel?
All right, if we'll expand it up through first initials A all the way through L. A through L, please.
Hi, good morning, guys. This is Fernando. Can you hear me okay?
Yep. Hi, Fernando.
Okay, great. Good morning. Fernando with Disability Voices United and the Integrated Community Collaborative, Integradoras. Wow, I don't think I've drank enough coffee to kind of digest this whole, just the meaning of what this whole conversation has been. And Amy, at the beginning, when you're making your comments, you had mentioned the word conscious, the people being cautious. But boy, I can't even imagine that being the right word. It's more like fear. And I understand this community very well, mostly the Latinos. I know it applies to not just Latinos across the board. And even though right now it seems like there's no reason to panic or just because there's still the whole process that has to go through. I believe that our community will already be impacted, and they'll kind of go back into the shadows. We really have spent a lot of time and effort trying to get people connected from our community into the system. But you take, for example, DACA and what they've gone through, and it's very similar. That fear, that intimidation, for the families who don't have the proper documentation. But here's my question: a lot of the families, significant amount of the families, have both the citizens, which would tend to be the second, third generations who are American citizens, right? But may have parents who are not properly documented. So how do we manage that?
Yeah, I can take a stab at that. So now the benefits that anyone in your household or your family use, right, or even just anything about the other people in your household and, their health status or all the other factors I mentioned are not considered in your case. So if you yourself are at the point of applying for a green card, it doesn't matter what your mom, dad, son, daughter, that it doesn't matter if they might have been enrolled in a program. So that's one thing to keep in mind. Another thing for a lot of our undocumented community members is, think about, are you at any point in the foreseeable future going to have a pathway to apply for a green card? And I know everyone hopes that they will, but, that's a really important thing to think about because the proposed regulation actually mentions a 36-month look-back period that's, most relevant for the test. Again, that's just the proposal. We don't know what will actually be. But so what that means is potentially, let's say 5 years down the line, this new rule is a reality. They would only look back 36 months. Before that, it's not very heavily weighted before 36 months. So if you are right now, I know that in the next 36 months, and well, first of all, what benefits you use now up until the implementation date don't even count, right, if they're not currently counted. But starting that implementation date, moving forward, if in the next 36 months after that, you don't have a foreseeable path to even apply for a green card, which is true for a lot of our undocumented community members, you may not even face this public charge test anytime soon. If something changes, you have some kind of pathway through marriage or through a citizen child or whatever who someone can sponsor you, then that's the point at which you might want to start thinking about that. Unfortunately, there is still a lot of uncertainty, though. And, it's important to remind people it's the totality of circumstances. So let's say, yes, you enrolled in one of these benefits, even after the implementation date of the rule, you're enrolled in a program. You have to work with your immigration lawyer now because it's very case by case, but you can also make the case that, yes, at some point I got Medicaid recently. I also have this certification, a new certification that I have a particular skill set and it makes me, fully employable. I have the means to support myself. So it's all these things are weighed. So there's no cut and dry way to be able to tell. Does that answer your question? I don't know if there was something more specific within the mixed status family that you were trying to get at.
No, that answered the question, but it added to the point in the sense that as we go through the process of trying to figure this out and hoping that it's going to go into litigation for years, you have a really important dynamic, and that's where my concern is. And the groups that are represented in this conversation today, what are we doing to manage the damage that this is going to cause just by the fact that it's introduced and it's being discussed at the level that we're even having the discussion? I know that it's going to have a negative impact on our community, and people are going to be afraid. They're not going to want to participate in events. They're not even going to want to go online and make comments because they fear the fact that somebody's going to grab their name and so forth, and they're going to come and knock on their door. So what kind of plan do we have in place to help manage that aspect and help people navigate those concerns, if any?
Yeah, I'll say something quickly. This is Sarah, and then let others chime in. But you're exactly right that I think part of the goal of this administration in proposing this regulation, they've already achieved because they've I've heard anecdotally, it's a very hard thing to measure, but I've heard anecdotally left and right stories of people are afraid, people who are not actually even subjected to the public charge test, and the benefits are, it's not even in effect, but they're already calling our offices, telling us they want to disenroll. I'm saying this is what I've heard from other service providers, and that chilling effect is, they've started to achieve their goal already, which is to drive people further into isolation, poverty, all of these effects that come with not seeking services that help people get by. So, to the extent that we work with these individuals in these communities, we should try to give them reassuring messages. I know it's hard. I know it's people are not always going to buy it. They're going to act in the most cautious way possible, but try our best to reassure them that nothing has changed yet. If anything, now is the time you should continue to get the health care that you need, to get the food assistance, whatever it is that you need, and come to us. We will provide you with the information if and when things change. And another thing that I will share that hopefully can be distributed to you all via email is a directory of state-funded immigration legal service providers. Our state funds what's called One California, which is nonprofits that provide immigration legal services at low or free cost to people, and people can go in and have someone sit down with them and look at the specifics of their immigration case and try to give them a little bit better advice. That might be a little bit more reassuring for people because it's so case by case. So I'll share that as well. So we do want to empower people with information and resources and the right information to fight that chilling effect as much as we can, but I recognize that it's difficult. And there's a lot of folks, within California, we have a coalition that's working on that. I mean, we're working right now to really drive comments and to try to stop the rule and to oppose it. But there's a number of people within our coalition that fighting the chilling effect is really their primary goal right now. So I'm happy to, add you to that coalition just so you can be in the loop and hear what others are strategizing around to try to fight that. And happy to just loop you in. So I'll make sure to share my email after this call. And the best that we've been able to do is just talk to each other and come up with ways that we can help. We've been actually pushing our counties and our state government, all these agencies that administer these programs, to say you need to educate all of your frontline staff for when people come into their office and say, I want to get off Medicaid, I want to take my family off food stamps, to know what public charge is, at least the basics of it, and be able to tell people, look, nothing has changed yet, to be able to give people accurate information because they're those frontline people. So we've been doing advocacy at that level to try to get the right information out to people right now.
Daniel Savino here. Just want to let you know to the presenters, we do have several folks who are unmuted and I'd assume looking to ask questions, and we are only in the A through L section. If you have asked your question or have found an answer already, please mute your line again if you were unmuted, and just want to raise a heads up on that. So I'd like to turn it on to the next questions.
Okay, this is Crystal.
Heather. Oh, Crystal?
Yes, but I already asked one question, so if you want to go first, that's fine. I understand. I'll wait. I'll hold my question.
I had a question. No, go right ahead.
All right, thank you.
So let's have people who've asked one question wait in line. And so I believe there was a Heather who was asking. I heard that name.
Yeah.
Okay, let her ask and then I'll ask.
Okay, thanks, David. Go ahead, Heather.
Thank you. This is Heather Jackson. I'm a special education attorney in private practice in Los Angeles. And sorry, I have two questions, but I'll ask them quickly and I'll get off the line. One is if we have any idea how much will be up to the discretion of the immigration agents that are processing the applications. And the other is, do we know anything about what we used to call sort of the humanitarian exception, like a family who's got somebody with a severe illness that needs treatment, or children with severe disabilities where this is the only place that they can get adequate treatment? Thanks. I'll get off the line now.
Yeah, so a lot is up to the discretion of the immigration official. Like I said, they mention a bunch of, and that's true today as well. It's just that the definition of public charge today is so narrow that, it doesn't come into, it's not used as grounds to deny someone entry or permanent residency that often, to be honest, because it's so narrowly defined right now. and the administration's trying to widen that vastly. But yes, so they name a bunch of new factors, and they say all of these can be considered, and they mention some of them as being more heavily weighted. But beyond that, they don't specify how heavily weighted. Like I said, there's no mathematical formula that this is 10 points in your favor, this is 3 points against you. So it's a lot is up to the interpretation of the official. And that's part of what we're raising in our comments as being a problem with this rule. And then the second piece, so the people that are exempted, it's by immigration category. The exemptions to who's not subjected to the public charge test when they are trying to enter the country or when they apply for a green card, those are written into statute. There is language in federal law that's very lengthy, actually, and it lists a bunch of different immigration statuses that are exempted. So it depends what pathway that person is applying to. Like I mentioned, refugees and asylees are exempted, people fleeing violence and trafficking and victims of certain crimes. And then, there's probably a number of other humanitarian exceptions, but it would depend on what is the status that they're applying for. And then I could tell you, is that status subjected to public charge or exempted? So that's a question I think you'd want to get specific advice from an immigration legal services provider. Or I'm happy to look it up if you can tell me the specific status that the person is using as their pathway to apply to enter the country.
Thanks, Sarah. David, did you have a question?
David Oster, Board of Directors. To the INS lady and Judy, I had a question. The new public charge rule says that in the House that if someone has mental illness, I have mental illness as well as autism, that they cannot attend school, a job, maybe regional center services. I'm born here in the U.S., but, I'm still mad at what's going on. But is that going to affect me?
So, David, is not going to affect U.S.-born individuals, but I'm really so thankful that you are concerned about others who may be in your circumstances
I was born
but are not. So, Sarah, I don't know if you want to also answer David's question.
Yeah, no, your answer was exactly right. If you're born here, you wouldn't be subjected to the public charge test.
Great.
So I don't like the federal ID either. So.
Yeah, thank you, David. Appreciate your support.
Daniel here jumping in again. Once again, it's *6 to mute or unmute yourself for questions. If you've already asked a question, please go ahead and remute your line. And at this point, recognizing the short time, I do want to suggest that we open it up to anybody who still has a question that has not yet been asked.
How do you remute it?
*6, please.
Lisa Cooley.
Hi, Lisa.
I have a question. Are early periodic screening and diagnostic service, treatment services, and mental health services for people who have those needs exempted from public charge or not?
Is EPSCT paid through Medicaid, and is it federally funded? I actually don't know the answer to that question.
I think it is paid for through Medicaid and or federally funded.
This is Alyssa Gershon. Yes, EPSCT is essentially Medi-Cal for people under the age of 21, so it is Medicaid. And unless we hear otherwise, my assumption is that it is treated exactly like other Medicaid services that are referred to generally in the proposed rule as Medicaid. So EPSCT services that are funded to provide special ed services through the Individuals with Disabilities Education Act would be excluded, but otherwise children receiving EPSCT would be subject to the same rules as adults.
Yeah, I'd agree with that.
Thank you.
Thanks, Lisa. Next question, please.
Hi, this is Maria Dane calling from Parents Helping Parents.
Go ahead. Thanks.
And I have a question circling back on the earlier question regarding mixed status families. I just want to be sure I'm really clear on this. We have a lot of families who the children are citizens who have profound disabilities, and one of the two parents may be undocumented. Does the citizenship status of the child impact the public charge issue?
Good question. It wouldn't.
Okay.
It wouldn't under the current language. But I know why a lot of people are confused by that is because earlier this year, around March, there were some leaked documents that were like a draft of the proposed rule, and so that's why we knew several months ago that the administration was working on this. In those earlier leaked drafts back in March, they did include, like, hey, if you're applying for a green card but your child received benefits or household member, that could also be counted against you. That was included in an earlier draft. It's not included in the current proposed regs. So doesn't matter if, a child or family member or household member receive benefits. It's just you yourself, what your status is with respect to all of those factors and what benefits you receive.
Okay, so if it's a child applying for the green card, and they were receiving services, it impacts it, but it does not affect the parent if they're applying.
Yes, exactly. If the child themselves is a green card applicant, it would matter what benefits the child receives.
Okay, thank you.
Next question, please.
This is Maureen Graves from Disability Voters in CAPCA. I'm trying to see my way to being reassuring, but I'm wondering, given that the processing person is supposed to consider the likelihood of becoming a public charge, wouldn't it make sense for them to look at past history of utilization of programs that are now covered? And also, even if they shouldn't be doing that, won't they realistically? So I'm wondering how reassuring we can be to people. And even if there's a 3-year look back, in theory, if somebody mentions that they did this 4 years ago and they're about to have a recurrence, won't that be considered?
Yeah, that's a good question. The test really is actually what the immigration official is assessing is, are you likely in the future? And, what your situation has been in the past, they can consider that as indication of the future. Now, technically, again, they shouldn't, if the situation was that you used a particular benefit before the implementation date of a new rule and those benefits weren't counted, technically they're supposed to not consider that and not include that in their assessment. And, if the immigration official takes their job very seriously, they would do that. And I think that's how we're used to this, this process working up until now. It's tough to say how it would work in the future if the immigration official doesn't take the interpretation of the law and of the regulations very seriously, and they know that someone received, Medicaid in the past before the new rule was implemented. Will they really ignore that factor and not consider it in their assessment of what the person's situation might be in the future? I would hope so. And, it would be grounds to challenge the determination if they, if you can reasonably say, like, look, I think that there's no other reason why you denied my green card other than that Medicaid I had in the past when it wasn't actually counted, then you could challenge that. But yeah, it's hard to say with certainty. It really depends on how seriously that immigration official takes, the interpretation of the law. I think legal help is very important in these types of cases, which is already true today, right? When people go through filing for adjustment of status or anything else related to immigration, it's very important that they have a good lawyer because there's so much that's really up to like interpretation of the law, and you want someone that's able to catch anything that seems like it's off or unfair or an accurate interpretation. So that's going to continue to be true under these new, under potentially new rules.
Great.
Hi.
Let's try to get a couple more questions and just run a little late because I just want to make sure that we answer everyone's concerns. Any other questions?
Yeah, this is Maria Iriarte with Disability Rights California, and I want to go back to the CAPI question that Crystal had. So I understand CAPI to be a state-only program that's available to people once they become a lawful permanent resident, and there's that 5-year wait to be able to get on SSI, for example. You can apply for CAPI. So why is CAPI a benefit that would be looked at?
Well, it's actually cash assistance and long-term care are included in the current definition of public charge, and there's no language about who funds it. It doesn't matter who funds it. So if you receive cash assistance for income maintenance or are institutionalized for long-term care paid for by the government, that's currently already how, what's considered a public charge. Again, it's a totality of circumstances, so it's not like you automatically are deemed a public charge. Especially if, that was the case in the past, but no longer is the case, something changed, and you're like, now I'm not in need of that benefit, that helps you, so it's up to interpretation. But yes, currently, the current rules for public charge don't say anything about state or federal funding.
But when I guess my question, I'm still confused because CAPI is not available to anyone who's not a local permanent resident. So
sure. You're exactly right. Sorry, one thing I didn't mention is a lot of these benefits that are included, you can't even get if you're not already a green card holder. So it's not even a consideration because that person's never going to face the public charge test. You're exactly right. Someone already has a green card, they're not going to go up against the public charge test in the first place.
So another question or comment?
Hi, my name is Elizabeth Gomez. I am a Disability Voices United ambassador. I am also an integrated community collaborative integradora. And everything that you have talked about in this call is very much affecting the community that we work with directly. And I just want to thank everyone here this morning for giving us this information. Of course, for us, there's a million questions in my head in many different phases and scenarios that are very. This is actually putting fear in me. I can't imagine what everybody else. But my question would be: usually when you say, write comments, get the community to get involved, it's usually not something that would cause this much fear. But I'm asking. My question is it the right thing to let the community know that this is the time to ask questions, or do you think that this is actually going to be negative because it'll put a lot of fear, as I think it would? But it's just I guess I need a suggestion on this.
So basically, what you're asking, Elizabeth, is it's kind of a balancing act of informing the community about these proposed rules to enable action and get them to write comments. At the same time, you don't want to instill undue fear into the community so they don't go and access their needed services. Is that basically what you're asking?
That's exactly what I'm asking. Thank you, Jane.
Yeah. So, Sarah, I don't know if you're seeing that in other communities that you've been doing outreach with and how they've been able to manage that balance.
Yeah, I think it depends on the particular individual you're talking about and their comfort level. So it's kind of case by case. I hate to keep saying that, but it's kind of case by case. If they're someone that's like, I want to take action, I fully understand that, me being involved in the comment process is my opportunity to fight back. Then I think it's good to encourage them to fight back. But I think the first and foremost, though, is making sure people have accurate information and are clear on what's true and what's not. I think it wouldn't make sense to ask someone to take action unless and until it's clear to them that, the rules haven't changed. And so I think I would say if there's a priority, it's number one, making sure people have accurate information. If you're working with directly impacted communities and their biggest concern is just like, how does this impact me? I would shy away from raising this unless and until they ask questions or unless and until they're part of, they're in some way primed to be activated and take action.
Thank you. Any other questions? Daniel, do you see any other people unmuting right now?
Hi there. This is Maria from Public Counsel.
Hi, Maria.
Do you guys know if there's any big orgs? I don't know if DRC or ARCA is publishing any comments for the policy, and whether you guys are opening it up for other orgs to sign on to your comments.
Daniel here at ARCA. We have submitted our comments through regulations.gov. That's certainly something you're welcome to take a look at if you just go to the comments site there. It's a little hard to navigate, so I'll be sure that when we as presenters do our back-end work to gather up some resources for everyone, I'll make a copy of that available.
And then this is Alyssa from DRC. We are going to be submitting comments from DRC. We're kind of taking the lead from our national organization, the National Disability Rights Network, and so we're going to be working with them, but we haven't done it yet. They will be posted on our website. As far as sign-ons, my understanding is that the recommendation is to get as many individual sets of comments submitted as possible. So I think that the national folks, and sorry, you might have a better sense of this, but I think that they are discouraging a set of comments with a whole bunch of sign-on organizations, and they'd rather organizations submit it individually, even if they work off a template and, kind of tailor to their own particular area of interest.
Yeah, that's exactly right. It'll be counted as one comment no matter how many people add their name to the email signature. So it's better to submit your own comment on behalf of your organization, even if you have to pull from other people's templates. And I will make sure that there's a lot of templates people have drafted up with different perspectives. So here's a template to talk about how it affects hunger and nutrition. Here's a template to talk about how it affects kids. There's a lot of those templates are already out and circulating. You're welcome to just grab from that. And, again, add a few sentences about your specific organization and who you work with and why you're equipped to really comment on this issue and why it impacts you or your community or your organization you work for, just to make sure that your comment is unique. It has, at least a few sentences that are not copy and pasted, but that's the recommendation, and I'm happy to share those resources. And I apologize, I have to get off the call right now, but I will share my email, and I'm happy to follow up with folks afterward. And thank you so much. And I hope that I equip people with information and empowerment more than confusion and concern. But, unfortunately, the former and the latter are sort of going hand in hand on this issue. So just thank you so much for taking the time to understand this more deeply.
Thank you, Sarah. Before you get off, I just want to thank you on behalf of the developmental disability community for joining our call. And if anything, I'll field a couple more questions, but if we have any questions that we can't answer, we will get them to you and to help us answer. Thank you for everything, Sarah.
That sounds great. Thank you so much. Bye-bye.
Bye. So are there any final questions? One of the things that's just really important is the takeaway from this call is that people do write those public comments. You can write them as an individual family member, an individual with a disability, but you can also write them from your organization. And what we'll be doing as sponsoring organizations is getting out to our communities as well as all the people who registered for this call, the various links for these for these websites. Also, the biggest one is called protectingimmigrantfamilies.org. In there is every kind of resource, every kind of template. You can join their mailing list. I get emails from them at least once a day where they're showing their latest. They have a social media recommendations. They're actually right now at 10 o'clock this morning in downtown Los Angeles, they're having, or at the federal building, they're actually having a protest. So there are going to be actions happening around the state as well. So I guess what I'd like to do is to just take any final questions that we may have, and we'll try to answer them, even though we're not the immigration people. Any other final questions?
This is Crystal Padilla with Disability Rights California. So my question is there, in determining public charge, is there a distinction between institutionalized long-term care and home community-based services long-term care? And is there a difference between the weighting on that as well?
So this is Alyssa from DRC. I'm not sure. Weighting in determining whether or not somebody's a public charge. So she mentioned a weighting system. There's more familiar than others. So currently, Medicaid-funded institutional long-term care, so nursing facilities, intermediate care facilities, or ICFs, those are already considered as part of the public charge analysis. Home and community-based services like IHSS, like Medicaid waivers, those are not considered. Under the new rule, I think our best understanding is that IHSS, Medicaid waivers, which
which is regional center.
Includes the regional center, right, includes the regional center, the DD waiver, as well as the DD state plan amendment. So it funds, at least, I think, 30% of regional center services are Medicaid home and community-based funded. Our best understanding is that those would now be part of the public charge analysis. I think what Sarah was saying is that in terms of how those are weighted, it's very subjective. So we don't really know. It's not a point system. It's not. There's no bright line. So I think we don't really know.
Thank you.
Any other questions?
Do you want to add anything else to that?
Yeah, I had one more question.
Go ahead, David.
Mr. Oster. With the Medicare and Medicaid, does this affect the public charge on me? Because I'm born in Santa Monica.
So remember, David, that you're not affected by this. It's for people who are not born in the U.S., who do not have legal status in the country. But for those people who are undocumented, if they're receiving any kind of Medicaid-funded benefits, it would, in fact, This
has never happened in my life.
Right. Yeah. Were there any other questions from folks? You need to press *6 on your phone. Hearing no other questions or comments. Okay. So we want to thank everybody. As we committed to earlier, we will be sending out emails to all of you. We will be gathering all this information as well as ways for you to write public comment. I really believe that the Trump administration, it's not that they're open to listening to our community on a regular basis. However, there is the factor if they receive tens of thousands of public comments, they can't ignore that. And so that's what we're really counting on here, is not so much that they have an open door policy to listen to our concerns, but that it is so overwhelming that they really can't ignore us. So so we really urge you to get involved and to write one of these public comments, and we just have till December 10th, which with the holidays is going to fly right by.
Yes, ma'am.
Hey, Judy,
yeah, go ahead.
Sorry to interrupt you. I know Ruby Saldana just texted me saying she had a question or made a comment. So, Ruby, can you? I think you need to put the asterisk 6 or the *6 and then the #, and it'll unmute you. Okay. They're having technical difficulties.
All right. Okay. She can definitely, anybody who has any remaining questions can, let's give out some email addresses. You can certainly email us at Disability Voices United at info at dvunited.org, Disability Voices, dvunited.org, info at dvunited.org. You can email me any remaining questions, and I can get that to Sarah. And we'll also get information out to everybody so you can join the coalitions that she has formed and find out the latest information as we move forward. So once again, thank you to ARCA and to DRC for co-sponsoring this call with us, and to Daniel for doing the hard work and the coordination of the call, which I know is always complicated. So thank you once again, and we hope to be with you again soon, and have a very happy Thanksgiving, everyone. Bye-bye.